In a game between the Atlanta Braves and the New York Mets, Ronald Acuna Jr. was hit by a pitch in the back of his left shoulder. Welcome! I am Dr. Stefan Wilson, and if you enjoy learning about the mechanism of injuries in sports and the relevant anatomy, then please like and subscribe to my page to receive notification of future videos. On the replay, we can see Ronald Acuna Jr. for the Atlanta Braves is the first at-bat of the game. Tylor Megill, the opposing pitcher for the New York Mets, lets go a high 93.4 mile-per-hour fastball that then strikes Acuna in the back of his left shoulder. Acuna is able to turn his body in time so that the ball does not strike him anteriorly or anywhere in his face, but as a result, he takes an intense blunt force trauma to the back of his shoulder. Upon seeing this replay, the initial concern is that he may have sustained a bone fracture, as a 93.4 miles per hour fastball could certainly do that. A muscle injury such as a hematoma is also a given, but also damage to a superficial nerve can also be a concern. Thankfully, a fracture was ruled out by the Atlanta Braves training staff, likely through the use of diagnostic imaging. Even though Acuna did not sustain a fracture, the anatomy is still interesting, and we can certainly still discuss that. On the video, we can see exactly where the baseball makes contact with Acuna's shoulder. There's a lot of muscle mass in that area of the shoulder with multiple layers of muscle. If you have the posterior section of the deltoid, the trapezius muscle, the infraspinatus muscle, and the teres minor muscle. These muscles help move and stabilize your upper arm, your glenohumeral joint, and of course, your scapula. If a fracture had occurred in this case, Acuna's left scapula would have most likely been the bone that would have been injured. When you look at the posterior view of your shoulder blade, known as your scapula, you can see how it is shaped rather oddly in one section. This long skinny part here that transverses along the upper section of the bone is called the spine of the scapula, with the hook of the acromion on the end. It does somewhat resemble the contours of your actual spine. If you use your own fingers, you can easily palpate your own spine of the scapula in your shoulder. It projects outwards and provides excellent attachment points for the soft tissue structures in the area. But in doing so, it also is vulnerable to pressure and trauma, such as a 93.4 mile per hour fastball coming out of the hand of Tylor Megill. Acuna was lucky that he did not sustain a fracture to the spine of his left scapula.